Firstly, let's just talk about the considerations that officials have to make when deciding whether or not to continue with a lockdown. What is utmost of mind?
So when we think about this particular coronavirus, like all other viruses, it cannot move. The virus is not able to move from one place to another or from one person to another. So it's really human behavior that helps it move from one place to another, human behavior that allows it to spread from one person to the next person. So we know that if we allow completely unregulated behavior and everyone is able to mingle with each other, this virus can spread rapidly. So the lockdown was intended to prevent that. The lockdown was to give us the opportunity to regulate human behavior so that we are not mixing with each other and spreading the virus. So there comes a point at which we have clarity about whether the virus is still continuing to spread or not. When we have that kind of evidence, we have then clarity as to whether the lockdown has achieved its purpose and whether we are now able to control this virus from spreading and can move on to another stage of our response.
Professor Karim, what are some of the markers of that? So is it down to the number of infections that you're reporting on a day-to-day? Is it the mortality rate that officials are going to be looking at? What are the specific indicators?
So the key indicator is the number of infections that we are identifying in the community and and cases that we are identifying in our hospitals and healthcare settings. So one of the things that's quite unique about the way South Africa responded that no other country has. So every other country has waited for the patients to get this virus, get the disease, and then get to the hospitals, and that's where they started counting the cases. In South Africa, we have chosen a different route. We've chosen to be proactive. We've chosen to go into the community and find the patients that have this virus. And so that has meant, and you heard the President announce, that we are putting in thousands of healthcare workers. As of late today, just over 28,000 community healthcare workers are going house to house in our most vulnerable communities where we expect this may be spreading, to go in and check for symptoms and start the testing so that we get people from the community testing for this virus so we get an idea as to whether it is spreading in our communities or not.
Professor Karim, the conversation that many South Africans are having now is exploring the possibility of this lockdown being extended. And, of course, economists are weighing in on the extent of what that will do, especially for the country's economic state, and whether or not we can actually afford to extend this lockdown. From a health perspective, what would officials like yourself be looking at should this lockdown be lifted after 21 days? So, what kind of life would South Africans be able to expect in order to manage that rate of infection?
So right now we are simply not doing enough testing. We have tested just simply too few people. We need to be testing lots more people, somewhere between 10 and 15,000 a day. So that will give us some idea as to where this infection is continuing to occur and give us the opportunity to stamp it out. Without that, we don't really have the evidence we need to make a determination about where we are with the epidemic. But even if this lockdown ends, as was originally planned, after 3 weeks, we simply cannot go to life as usual. We will have to remain vigilant, that we maintain social distancing, we continue to wash our hands, because South Africa, as it stands, we are still a highly vulnerable situation where this epidemic could take off at any time. So we're going to have to remain vigilant even if we do not have a lockdown situation.
Before I let you go, today, of course, we've seen the visuals coming out of China where the lockdown has been lifted. Are there immediate concerns about this taking place in as far as the spread of COVID-19 is concerned?
Well, it's fascinating when we look at the lockdown itself. You know, the Chinese were the ones to first implement it, and all of us are simply doing what the Chinese did because they found that it was very effective. And now it's been, about 76, 77 days of their lockdown that they finally are releasing their lockdown. So that means roughly 2.5 months. That's a long time to be in a lockdown. But if that's what it took in Wuhan to get from the epidemic that they had to a situation where they feel they are no longer at risk of local transmission. Of course, they have to remain vigilant because all it needs is a few travelers to bring in the virus from the outside and it could start spreading again in Wuhan. So they're going to have to put in place those kinds of measures, and those are exactly the kinds of measures we are busy planning to put in place in South Africa.
Professor